Hello, my name is Audrey Toluchek, and this study of parenting children with cystic fibrosis was funded by the CF Foundation. While medical advances are improving health outcomes for children with serious illnesses, their parents must assume more and more responsibility for ever more complex and labor-intensive home care, and they must do so within the context of their child's social and emotional development. CF is a good example of just such a condition. The purpose of this project was to gain a better understanding of parents' experiences with managing the health needs of their children from infancy through adolescence, and to identify potential actionable unmet care needs. The CF Foundation launched a quality improvement initiative that involved surveying parents from 125 care centers throughout the United States. Our team was tasked with analyzing qualitative data generated from 6 open-ended questions in that survey. We chose data from the most recent calendar year, which at the time was 2017. We selected data-rich samples, meaning a lot of words, from 20 parents in each of 4 age groups, for a total of 80 parents. And we used grounded dimensional analysis as an analytic method to assure trustworthiness of our interpretive results. We innovatively included 2 parents of children with cystic fibrosis in that process. All of this was approved by the IRB at the University of Wisconsin-Madison. Analytic results revealed 2 central themes. First, while parents' management efforts may often be known to clinicians, there are many aspects of their work that are not so visible. Second, parents actively engage in activities that expand their expertise in the management of their child over time. The first few years after the diagnosis is typically characterized by parents trying to figure things out. That's a quote from one of the parents in our data. And they often do so on their own. With time and experience, they become more confident, they claim their expertness, and assert their expertise. We use the metaphor of a tree to illustrate these concepts. This young tree represents parental expertise shortly after diagnosis. Observe the visible trunk and branches of the tree that represent new growth and development of parental skills and strategy in managing their children's health needs. The sapling tree needs extra support, typically offered by care teams. Now also note the types of activities that are above ground and thus visible. Activities like building relationships with clinicians, performing treatments, and advocating for their child are likely to be known by clinicians. But if you look below the surface, you see many other activities like normalizing life, monitoring threats, and managing emotions that may not be so visible to clinicians. This metaphor also uses clouds for CF symptoms that can be variable and sometimes unpredictable. The hopefulness engendered by CF research is represented by the sun. Now, this illustration of a mature tree represents the fully evolved expertise of parents of adolescents. They now have a much larger repertoire of skills. Now they are sometimes actually educating providers and advocating at a systems level to help other children as well as their own. They do all this amid mounting burdens of their child's care needs, which may still remain unseen and unknown to clinicians. So these findings suggest a need for building communities of parent-to-parent peer support starting at the time of diagnosis. Clinicians can adopt a philosophy of complementarity in which parental expertise is recognized as having equal value of that of professionals, especially when developing treatment plans. Clinicians can tailor clinical approaches to each child's maturity with input from parents. For example, not all 12-year-olds are alike. Some are much better than others at providing an accurate clinical history. Other children may still need some more scaffolding, which parents can help clinicians with. Use a holistic lens to understand each family's circumstances when selecting treatment options so that they're truly feasible to particular families. Clinicians can also explore hidden caregiving activities and collaborate with parents in finding additional services for them. Finally, our data suggests mental health services remain paramount to child and parent well-being throughout the lifespan. In conclusion, parental expertise is essential to family adaptation and child health outcomes. National surveys like the one developed by the Cystic Fibrosis Foundation can be valuable tools for identifying unmet family needs. Thank you very much.